Hey, Carol, how you doing?
Good morning, Carol.
We're hanging in there like everyone else.
Yes, sir.
Okay. Big news for some counties. You can get your hair cut, you can get your your nails done outdoors. And San Diego County, one of the counties that the governor has allowed that in, but not Imperial County. And why not?
Well, I'll take that, Carol. So essentially, yes, you're correct. The governor did provide that option for the counties that have submitted had their variance report in, their attestation plan. Given those counties that are on the monitoring list, they've been given the option of continuing their services, but they have to do it outdoors. So for hair barbershops and beauty salons, outdoor dining facilities, they basically had them close their indoor component, but allowed them to operate their outdoor component if they have the ability to do that. Unfortunately, for Imperial County, we don't have that. Wasn't an option for us. If you recall, the county was essentially directed by the state that we needed to step back with regards to our high positivity rates and our high case rates. The county doing that, in essence, we basically returned back to stage one, but not quite back to stage one. They're still allowing us to do the curbside services. So again, and we don't have our attestation or our variance in place, so then that doesn't allow those businesses who have that high risk stage two when they're in that category, or they have their variance report in, allows them to step into that open up that industry, that the barbershops, the indoor dining, allows them to do that. So since we don't have that in place, wasn't even an option for us, even though we're still on the monitoring list. So we still are challenged with that, and hopefully if we continue to get our numbers down, that we will hopefully be able to submit our variance report and move into that high-risk category in stage two and be able to offer those services to the community.
And for that to happen, it's going to take the people in Imperial County to begin complying, better complying with the mandates. The facial covering, the social distancing, and I know they're family, but they don't live in the same household, don't get together for that birthday party or that family event. That's where the spread is coming to a great degree, right?
That is correct. That is correct. We really need the community to come together. Our community has gone through a lot these last almost 4 months now. We just need everybody to continue to do what they're doing, continue to play an active role in this, and if we can just for the next couple of weeks, if we can really try hard to follow the guidance, to wear the face coverings, to minimize our outings where we can, to skip the group gatherings, the social gatherings. That would give us a good chance to continue to bring these numbers down. Our numbers have definitely dropped. But we need to get them further down in order for us to move forward with our attestation plan. And that's coming together as a community to be able to do that is not only going to help us individually, it's going to help protect our loved ones, our family, our friends, but also it's going to allow us to get these businesses open. So again, everybody needs to do their part. If we can work together, really focus on it over the next couple of weeks and see what we can do to get these numbers down.
Okay, and the numbers, you said they are improving. I see, looking at the numbers on a daily basis, slight movement in the right direction. And where are the numbers? Where do they need to be?
So, Carol, this is Tony. The numbers currently are at 16%. A couple weeks ago, we were hovering around high 20s, around 29%. We need to be at 8%. I just want to say I think the community is doing a tremendous job on helping us get the numbers down. But you brought up a great point. The fact that what is direct family, what is your close family, and that's the family that resides inside your house. And I think sometimes as we talk about close family, of course, our parents and our brothers and sisters and aunts and uncles, they're all close family. However, the meaning of that is just to really be with the ones that you cohabitate with on a regular basis and not expand upon that. And that's truly hard. I know not just for this community, but for the entire world to go by. But that's really how we help prevent this. So you mentioned that, so I just wanted to expand on that a little bit. So the numbers we're really concentrating on now are the percentage of positive cases of the overall. And like I said, right now we're hovering at 16%. We need to be at 8%, but we've made tremendous progress, and that's from a lot of the hard work and the dedication that our community has done to help us get those numbers down. However, the other numbers that we need to be cognizant of is the hospital numbers. That would be the amount of people inside the hospitals, the amount of people in our ICUs. And, it was mentioned over all the national media about the amount of transfers that we had out of this county. We had well over 500, almost 600 transfers out of this county to hospitals throughout the state. Those transfer numbers are down, which is a great sign. However, we need to maintain that, and the last thing we want to do is inundate our hospitals. The hospitals have been working nonstop for the last few months, so we need to maintain surge and make sure that they have the resources to maintain the services to provide for other illnesses, not just COVID. So that's an extremely important part that we need to monitor.
And one thing we should point out also is the amount of aid in the form of bodies, boots on the ground, that the state and the federal government have provided to the local healthcare organizations.
That's true. A lot of both hospitals have been afforded to have personnel to help staff the emergency rooms and other services throughout the hospitals. Also, the facility out at IVC has a great deal of staff out there as well. We've pushed a lot of people to utilize that system, and they've been pushed out there and been able to rehab at IVC before returning home. That's been a great asset also. And I'll let Jeff go over some of the staff from the state that has been there to help assist public health as well.
So we've had quite a bit of assistance from the state. We have been able to increase our contact tracers and our investigators considerably. We have basically 50 contact tracers now in place with the assistance of the state, and the same 54 are investigators as well. And so we have that. We've been very fortunate to have that assistance, and that's been helping out. Again, we have a lot of work to do with that, but with the state's assistance, the state's helped out in a variety of different capacities. We have teams that are in place, as Tony had mentioned, with the National Guard. We have our mobile testing unit that's been assigned to Imperial, or been mission tasked to Imperial County, which they have the ability to process 200 tests per day using a rapid test method. So that is very helpful. It allows us to really focus in on those individuals, those patients, or those individuals that are high risk, that we need to get a quick turnaround. We primarily using them for our skilled nursing facilities, but there are other areas within the hospitals that they have a patient that they need results back very quickly, a high risk individual, then we can process that information or process that test quickly and get those results back to either the hospital or the private provider to provide so they can make the adequate determination as to what direction they need to go. But real quick, if I would like to do is just kind of touch a little bit on the state's data monitoring list. I know that's been a topic this last few weeks, and as you've heard, that there has been, the state has developed the metrics that all of the counties must follow in order to demonstrate that they have specific programs in place to control the spread of COVID-19. And as we've discussed in the past, where there's the majority of the counties, I think there's roughly about 56 of the 58 counties have had the opportunity to have their variants in place, their variants report in place. They've submitted their attestation plan. But of those, there's approximately about 36 of those counties have been placed on the state's data monitoring list. And essentially what that means is that those particular counties, one or more of their parameters set forth by the state, their monitoring parameters have exceeded. To give you kind of an overview on that, Just kind of touching on those, the things, the keys that they have to meet, the monitoring requirements they have to adhere to are the epidemiological stability. Examples of data monitoring include the rate of cases per 100,000 inhabitants of the county. Just to give you kind of an example of where we were at 3 weeks ago, we were averaging almost 800 cases per every 100,000 residents. That's extremely high. Currently, we're at 271, and so we've dropped down considerably, and we're stabilized in that area. We need to bring it down to below 100. But nonetheless, we've dropped considerably over the last 3 weeks. Then another part of that is the testing positivity, and that's the one that we've been focused on initially, because of the rate of cases were so high that we didn't think that we could actually get that one down. So we had the option of either doing the case rate per 100,000 or the testing positivity. So our focus initially was on the testing positivity, but it looks like we can hit either category. So the testing positivity has a 7-day average, and we have to be less than 8%. And as Tony had mentioned, we're hovering right around 16%. That too has been quite high. It's spiked quite a bit. We've been up in just a few weeks ago. We were up in the low 30s and the high 20s, and we held that for a while. Over the last 2 weeks, we've dropped down to the low 20s to the high teens, and we've been hanging right around between 16 to 18 for the last week. So hopefully we'll continue to bring that number down, as well as our case rate. In addition to that, we need to decrease in stability in the number of hospitalized patients. And again, we've talked about that. We're currently at 17.6% on that. There's some other categories within that range, but also there's the hospital capacity to serve the population. So we need to make sure that we are able to achieve that. We need to have guidelines in place for essential workers. We are meeting that requirement. The ability to test for COVID-19 patients or individuals in the county. Our case, basically, we have to achieve the 1.5 per 1,000 residents, and currently we're about 4.3, 4.2, right around in that range. So we're doing actually very good. And I'm going to come back around and talk a little bit about our testing sites before we conclude here. The other category is we need at least 15 case trackers per 100,000. And as we indicated, as I said a little earlier, we're averaging, we have about 50 of our contact tracers with regards to that. We must have the available housing for our homeless, and we're meeting that standard or that requirement as well. And then finally, we need to work with our skilled nursing facilities to ensure that they have mitigation plans in place and they have sufficient supplies of PPE. And again, we're meeting that parameter as well. So in general, we're looking good. Our main focus is in that epidemiological stability component, and we need to continue to meet the hospital component as well. We seem to fluctuate up and down with that one, but we definitely can bring that to meet that requirement. Again, the big focus is the hospital, the case rates, and/or the testing positivity. So we really need to focus on that, bring those numbers down. And again, as Tony had mentioned, the community has done a great job at working together and trying to bring these numbers down. We just need to, kind of take it through across the finish line there, if you will, and everybody needs to, continue to do their part and work together to bring those numbers down. If I could, Carol, if I could talk real quickly about our testing sites. So we have the three Optum-served testing sites. We have the one that's located in Brawley. It's a single-lane facility at 575 J Street. We have also an Optum-served testing site in Imperial at 247 South Imperial Avenue. It has two lanes available, which gives it the capacity to test up to 287 patients per day. And then we have the one site in Calexico at 707 Dual Avenue. That's our community center. Over the last, I would say almost the last 2 weeks, we have not been hitting the facilities have been underutilized. We're not hitting our capacities or hitting our numbers with those. For example, today in Imperial, again, as I mentioned, the scheduled capacity is 287 patients per day. Right now we have 69 patients scheduled. So we have quite a bit of availability in all three sites for the public to go in and get tested. So we'd really encourage the public to take advantage of these sites. These sites are free of charge. If they call, what we're seeing, again, there's availability every day right now. So if someone were to call or make an appointment, they most likely could get in today for their appointment. So that is available to the community. While those services are still here, I'd really encourage the community to take advantage of those. We have the three testing sites that are available to them.
Okay, one thing that we have been making sure we've let people know, you do not need a doctor's referral for the testing. It is free, it is painless, and in Imperial County, you're getting results in maybe a quarter of the time that you're getting them in many other counties because of the extra help that has been brought in. And we've encouraged everybody to get tested, even if you've not had contact with somebody that tested positive or has the COVID virus. That'll boost the numbers of negative tests.
Yeah, that's a great point, Carol. And here's the deal is I think we've seen this nationwide where other communities are kind of struggling and asking for additional testing to be done. We were granted the opportunity to have these additional lanes put in Imperial County. However, if we don't keep them filled on a regular basis, they could be moved to an additional county. I was watching national news last night, and there was, I think it was the governor of Colorado was talking about a 12 to 13-day turnaround on some of his testing sites and how that's just unacceptable. And you're absolutely right. Now that we have the resources here, we need to take full advantage of that. We're going to ask the community to go out and get tested. Whether if you don't have symptoms, if you feel great, let's just go get tested anyways. We need to keep those lanes filled, and it's a true asset to our county right now. We need to take full advantage of it. So I would ask the community to join us in going out and getting tested, because that will help get that number down. And
it is painless.
Yeah. There you go.
And it will take maybe at most 15 minutes of your time, at most. So speaking from experience, okay? So get tested. Get those numbers down. Jeff, you may not be able to answer this because I have not been able to get an answer. You mentioned there has to be plans in place for skilled nursing facilities or SNFs, and the local nursing homes, assisted living facilities, what are the numbers like in those facilities? Is there a breakdown on that?
When you say the numbers, are you talking about positive cases?
Positive cases and deaths.
I don't have those numbers. In front of me, we've had positive cases in the skilled nursing facilities and some of the assisted living, in a couple of the assisted living facilities. Again, we are monitoring that very closely, working very closely with the skilled nursing facility and the facilities and the assisted living facilities, their administrative staff, and obviously with Dr. Monday's guidance, we are monitoring those to test at a very frequent basis, not only the staff but also their patients. So we're monitoring with regards to that, and working very closely with the state as well to try to control any outbreaks that may occur. Again, we've had some in the past. We're continuing to monitor those and to try to keep those down and ensure that they're being tested. Right now, we're doing testing weekly. And if they need it more frequently, we do that as well. And that's one of the services that we're using the mobile unit, the mobile testing unit for. So I don't have those numbers in front of me, but yes, we have had outbreaks at a couple of the skilled nursing facilities as well as the assisted living facilities.
Okay, because that has been those numbers have been significant in other parts of the state and the country. So just curious on that one.
They have been, and if I could just add, Carol, that yes, I think that our staff, the public health department, in conjunction and in collaboration with the state and the with these facility administrations here in Imperial County, they work very closely together, and have been very aggressive at trying to contain any outbreak that develops. And so I think they've done a great job with that. So yes, we have seen some cases outside of the state that have been very alarming. What we're managing with now, it seems like they're doing a good job with their, given they're in a confined environment, so it's challenging at best.
Okay, and a quick question for Tony, changing subjects. Last week we talked about recovery efforts from the Nyland fire. Have you been able to obtain any help on the housing and other issues?
Great question, and I got to applaud Jeff and his crew, George, also Perez, because we've been working shoulder to shoulder on that project as well. I think we've made more progress on that project. It's pretty impressive. So what happened this past week, we had asbestos testing on all 41 properties completed, received the results back on that. That's going to be mitigated. We had a very low percentage of asbestos, and we're appreciative of that. So it makes it a little bit easier to move to the next stage. Over this weekend, we'll start the plan of removing household hazardous materials, which is your paints, propane, acetylene tanks, paint thinners, and all that. So that'll be removed from the property. And we're working with a large nonprofit company that's going to come in and help us do the cleanup of the properties, and that is slated to actually take place as early as August 3rd. So it's moving a lot faster than we expected, which is great, but that just shows you that these guys are really putting a lot of effort working together and putting the plans together. Yes, we did receive, we talked about potential receipt of travel trailers for temporary housing while we work on long-term plans. We did receive a significant amount of travel trailers from the state. There's 2 programs that we received trailers from. Half of them are going to be utilized for homeless assisted living in the city. And I'm actually sitting watching a Zoom conference that's taking place with the city managers and county staff that's occurring right now as we speak. And the other half are designated for people that live in an island, and we're working on the plan for distribution of that coming up over the course of the next few weeks.
Okay. You just proved you can hit the curveball. Okay. Gentlemen, I appreciate the visit today. Good information, and it is going to take a community effort to get the numbers where they have to be, and right now it is definitely a numbers game.
So, Carol, just to finish this up, I know I've asked a lot from the community. Jeff's asked a lot from the community. We've lived here our whole lives. We know what this community is about. We wouldn't ask this community for anything we wouldn't do ourselves. We need to ask the community for a little bit more. I think the community is doing a fabulous job of helping us curve these numbers and going in the right direction. I'm very proud of this community, but I know we can do more. And let's make that difference and get past this as a team.
Okay, get tested. It's painless, it's free, it'll take you 10 to 15 minutes, and that will go a long way for me being able to get a haircut.
I can do that for you.
Thank you. My wife offered to do it, and again, she offered to do it with either the weed whacker or the chainsaw. So we'll move on. Gentlemen, we appreciate the visit. Stay safe, stay healthy.
Have a great weekend.
All right, Carol, thank you.
It's like a trip through time.
Do you believe in magic?
The Imperial Valley's best oldies on the radio.